Coming up in the news, the largest single vaccine donation to the Bahamas in country today. Also, another apparent sickout taking place in the healthcare sector. And a primary school teacher charged with unlawful sexual intercourse. The Bahamas Tonight, the Northern Edition, starts now.
This is the Bahamas Tonight, Northern Edition.
Good evening, Bahamas. I'm Shashina Roll-Farquharson. As always, it is so great to have you with us. Topping the news tonight, it was a red letter day for the Bahamas as the country received the first tranche of the nearly 400,000 doses of the Pfizer vaccine, a gift from the United States. The nation's leader, Prime Minister, the Most Honorable Dr. Hubert Minnis, on hand to receive 128,000 doses today. Sabrina Brown reports.
These vaccines will buttress the vaccines that are already in the Bahamas, will provide enough for Bahamians to achieve herd immunity so we can finally get through this thing.
U.S. Chargé d'Affaires Yusha Pitts on hand for the arrival of the first batch of the nearly 400,000 doses of the Pfizer vaccine, a special gift from the United States and the largest single vaccine donation to the Bahamas. Prime Minister, the Most Honorable Dr. Hubert Minnis, described the moment as significant and a turning point in the COVID-19 pandemic.
Receiving this first in a series of batches of the Pfizer vaccine will meet the demand for vaccines for the Bahamian people. The Bahamas is one of the first to receive this generous donation from the United States in this grouping of Caribbean countries. The infrastructure required for Pfizer has been met on New Providence and Grand Bahama, the two islands where the most population reside. We are an archipelagic nation of islands and keys, and we are grateful that all our islands and keys where people reside have the opportunity to be vaccinated.
The Prime Minister said the Bahamas is grateful to the American people for this massive donation, as it will enable the country to fully vaccinate half of its population, which will eliminate the need for emergency orders.
I thank the government of the United States of America, CARICOM, and Caribbean Public Health Agency, CAFA. I wish to especially thank President Joseph Biden and his administration. I also wish to thank U.S. Embassy in Nassau, the Chargé d'Affaires Usher Pitts, and other embassy officials. And I thank the Bahamian officials who helped in the process of securing these vaccines. An embassy provided critical logistical support for the rollout of the vaccine in the Family Islands, and with additional freezers to store the Pfizer vaccines and other supplies.
As the country can now meet the demands for vaccination, the nation's leader is renewing his call for the unvaccinated to take the jab.
What we need now is Bahamians to come forward quickly to take the vaccines. We need Bahamians to get vaccinated as soon as possible to save lives in the country. I say to the Bahamian people, you do not have any time to wait any longer. You do not have time to keep thinking about it. The hospitals are full to its limit. Sadly, some of our people are dying, and taking the shots will save your life. Not taking them can cost you your life.
But more volunteers are needed to ensure the program runs smoothly.
Volunteers to help in the dissemination of these vaccines. We need volunteers from throughout the Bahamas in all sectors: retired physicians, retired nurses, retired police, customs officers, union members, lodges, all Bahamian. This is not a political matter. This is in the best interest of the Bahamas.
There will be a phased rollout of the Pfizer vaccine beginning on Monday, August 16th. The Pfizer vaccine will also be available to young people between the ages of 12 and 17 years with the consent of a parent or guardian. Sabrina Brown, ZNS Network News.
Well, as the first batch of the Pfizer vaccine is expected to be distributed throughout the country in the coming days, Ramiko Knowles tells us that Grand Bahamians and residents are welcoming this arrival.
Well, it is good news for those wishing to be inoculated. Some 128,700 doses of the Pfizer vaccine arriving in the country today. Some Grand Bahamians are applauding government efforts. Prime Minister the Most Honorable Dr. Hubert Minnis notes that the Pfizer vaccine will be available to adults and also youngsters ages 12 through 17 with the consent of a parent or guardian, which means Bahamians will now have the option to choose the vaccine of their choice. Grand Bahama resident Fiona Gibson says she will allow her child to take the jab.
I make up my mind now I want to do the vaccine, and I have a 12-year-old daughter also. I need her to take the vaccine because they got to go to school, and I fear school gonna start having these virus because a lot of parents going away to Florida. They coming back with a Delta case over there. You don't know who bring it back here and could infect their child. Their child go to school and infect other children.
However, Gibson says as more vaccines become available, more vaccination centers should be opened on Grand Bahama.
I want to take the vaccine, but one side round there, someone gone and tell me they couldn't get their vaccine because too much people were there. So we need more sight. So people who make up their mind could go and get the vaccine.
Jimmy Levy says he is still in the Valley of Decision, but at his place of employment, it is being made mandatory.
As far as they're concerned, they make it mandatory. Because if they're forcing you to take it or don't have a job, what would you do? How could you eat? You ain't going to rob, you ain't going to steal, you ain't going to thief, so you can go take that just to feed your family. Maybe you didn't really want. Plenty of people take things they really didn't want, but they have to take it just through the situation. You know what I mean? And that's a force, whether you believe it or not.
Richard Goddard says he's happy to know that options are now available.
The reason why I think that's great is because I think one of the things that makes us great as a country is free choice as citizens. And for those families who would decide to take the vaccine and have their children take it to feel more safeguarded against the virus, I think that it should be readily accessible to them. But I definitely appreciate the fact that the government's taking steps to make sure that more than enough is here and present for the Bahamian people.
But there is an element of fear as it relates to children taking the vaccine. Bertha Hill explains why she is a bit hesitant.
I mean, that is a hard one. That's a hard one. Because then, I mean, if they say they have to, make sure they could give it to the kids. Because, they're so young and everything, never know what might happen. If the doctors say, the children could take it, well, they probably can.
Ramiko Knowles, ZNS Network News.
Well, the latest COVID-19 dashboard reporting 130 new cases in the country. New Providence once again in the triple digits with 117 cases on that island. 6 cases in Grand Bahama, 2 each in Eleuthera and Exuma, and 1 each in Abaco, Andros, and Bimini and Cat Key. Hospitalizations are now at 146, and 31 of those cases are on Grand Bahama, including 3 in ICU. The Ministry of Health is also reporting 1 additional death, an 83-year-old female of New Providence who died on August 10th. The death toll stands at 311 with 38 deaths under investigation. There are 2,640 active cases and 13,070 cases have recovered so far. And as COVID numbers continue to rise in the country, the government continues to implement measures to fight the spread of the deadly virus. New curfew hours have been implemented for several islands, including Grand Bahama, which is now on a 9 to 5 a.m. daily curfew. While this change is expected to impact some businesses on the island, tonight the president of the Grand Bahama Chamber of Commerce is weighing in on the new curfew and how it will impact the business community. Jamila Mizik reports.
President of the Grand Bahama Chamber of Commerce, Greg Larota, says, after speaking with business owners on the island, as expected, it was revealed that the new 9 p.m. curfew will affect some businesses more than others.
Areas where I think it would be more significant would be when you start looking at the fast food operators who are really going close to that 11 p.m. deadline. And then you look at nightclub operators, restaurants. Folks tend to go to dinner kind of late, 7, 8 p.m. And so they would have been in these restaurants after 9 p.m. So, of course, that now called for some changes. To the extent it negatively impacts them, I guess time would have to tell. Or I should say to the degree that it impacts them, because it would. But generally, we understand that given what's happening now with the COVID numbers, something had to be done.
The chamber president says the curfew is probably the best compromise as opposed to a lockdown. He admits there has been COVID fatigue, and he's sharing this recommendation for those businesses who may be impacted by an earlier curfew.
To say again, you need to make the necessary adjustments to still keep your business open and operating in a safe manner may not fall well with everyone. But of course, that's exactly what you need to do. Maybe for restaurants, for instance, you start dinner a bit earlier. For folks out there in the community who just want to get out of the house and maybe, I mean, granted, it has to be an outside environment, but you just want to get out and have something to eat with your family, then you need to realize that you may have to do that a little earlier and adjust and do your part to try and see if we can get this COVID situation more under control.
Now, the nation's leader, Prime Minister, the Most Honorable Dr. Hubert Minnis, has announced that the emergency orders will be extended one final time until November 13th. Larota says, given what's happening now, he feels the extension was necessary.
We still need to make sure that folks are adhering to the necessary COVID protocols. And it's my understanding that without those emergency orders in place, the Prime Minister or the government have no legal authority to enforce those actions. And I feel that we really need, now more so than ever, to be able to get folks to be more conscious of how they move about, the safety protocols in terms of wearing the mask, wearing it properly, sanitizing, and all of that.
Larota is encouraging both the vaccinated and unvaccinated to continue to do their part to combat the deadly COVID-19 virus. Jamila Missick, Saturday Network News.
Well, in other news, an apparent sick-out impacting the Grand Bahama Health Services today. Tonight, the administrator is reporting a delay in several areas, including the community clinics. Significant delays in the healthcare sector as another apparent sick-out could be taking place. Administrator at the Rand Memorial Hospital, Sharon Williams, says this time allied healthcare workers have called out, and it is having an impact on their ability to deliver efficient care to patients.
The areas that we are seeing challenges with today include our laboratory services. We had a number of staff calling in sick in that area, and that's resulting in delays in processing our laboratory specimens on behalf of our clients. Also, it's affecting our phlebotomy services, which is our area that draws blood and also deals with blood donations.
Here's how she says this apparent sick-out is affecting the community clinics and pharmacies.
Our community clinics are experiencing shortages in terms of support for our pharmacy services at the 8 Mile Rock Clinic, Hawksville Clinic, and also our PS Plaza clinic. At present, our pharmacy services is dealing mostly with our inpatients, our children, and our emergencies only because of the shortages.
But exactly why are these workers calling in sick?
We have not gotten any official statement from anyone, just a number of staff who have been calling in sick.
Our ZNS News team also reached out to Bahamas Public Services Union President Kimsley Ferguson.
Well, Shashina, I'm very concerned when I hear workers that we represent ailing. We have had a significant number of employees in the healthcare sector that would have contracted COVID-19. I am hopeful that this is not an area where persons would have not been observing the various protocols, and hence we have a little epidemic in that regard. And so I would have to do my due diligence to find out exactly what is going on. But I would say this much. I have a significant number of persons in the Public Hospitals Authority who are very concerned about this honorarium thing.
Now, Williams says she cannot say just how many workers have called in sick across the island. However, she is hoping to have a dialogue with the union and staff. And the Public Hospitals Authority releasing a press statement noting that the PHA advises the public that the Princess Margaret Hospital and the Grand Bahama Health Services are currently experiencing a sickout, which has impacted services beginning at 8 a.m. this morning. The authority therefore asks the public to expect delays in accessing services at these institutions and, where possible, to access services at a later date. At the Rand Memorial Hospital, laboratory services are reporting staff shortages resulting in a delay of services. The statement says phlebotomy services have also been severely impacted, as well as blood donation services have been suspended. The statement also goes on to list all of the other services impacted, while advising the public to follow all announcements and public advisories from the Ministry of Health and Public Hospitals Authority regarding health and hospital services. That is going to take us to our first break. Stay with us. We'll be back right after this.